As you know, from Monday the 19th of July, the vast majority of COVID-19 regulations are being abolished in England. I know that many people will greet that news with jubilation and can't wait to get back to normal. And I know that many others will be really anxious about this, particularly as we currently have rapidly rising case rates. So I just wanted to give you some context about where things are and what the risks still are, and to offer some advice about how to respond now that the rules have changed. First, it's true that cases are currently still rising. We've got more than 300 new cases a day in Cumbria at the moment, which is around the sort of rate that we were at New Year, and that was 10 to 12 days before the peak of cases in January. The difference is that at that point in January we went back into lockdown. This time, we're taking the restrictions off. So why is that? The main reason is that vaccination is doing its job. At New Year, we had almost 300 people in hospital with COVID across the North Cumbria and the Morecambe Bay NHS trusts. Right now, it's more like 30. At New Year, we had about 50 deaths in a week. Now it's more like 2. Vaccination works. If you're 18 or over and haven't had yours yet, please get the vaccination as soon as possible. So while case rates are rising fast, the serious consequences we saw in previous waves are following at a much lower rate. But that doesn't mean it's all over and we can just kind of ignore it now. We've still got over 50,000 adults who've not had a vaccine at all. We've still got 70,000 who've only had one dose so far, so they've got limited protection. And while we've had about 300,000 people who've had both doses, about 10% of them, about 30,000 people, will find that their immune system won't respond in the usual way and they won't be fully protected despite being vaccinated. So that's about 150,000 adults across Cumbria who are still vulnerable to COVID-19. Now, it's true that many of them are younger people who are much less at risk of dying, but they can still catch it, still pass it on to more vulnerable people, and they're also still at risk from the long-term impacts of catching COVID, even if they don't end up in hospital. And on top of that, a situation where you have high rates of transmission at the same time as high rates of vaccination is the perfect breeding ground for a variant of the virus to emerge that's more resistant to the vaccine, and we have to avoid that at all costs. So we have to try to keep the rate of transmission down as best we can. So what can we do now that lockdown's ending? 3 main things. First, I'll say it again, if you've not been vaccinated yet, please go and get vaccinated. And if you've had one dose and are reluctant to have a second, please get the second. With the Delta variant, the second dose is really important. Second, please take it easy. Just because we're now allowed to do lots of stuff again doesn't mean we have to. You're still much better off socialising in smaller groups, outdoors, or in well-ventilated spaces. And please do carry on wearing a mask in enclosed public spaces. That will help protect you a bit, but it'll certainly help protect others if you've got COVID and you don't know it. And third, please be respectful of the decisions that other people take now. If you don't want to wear a mask, even although I think you should, you don't have to. But please don't be critical of people who do. They're trying to protect you, and it would be nice if you showed them the same courtesy. But that cuts both ways. If you want to wear a mask, please don't judge people who don't. They may well have good reasons. The next few months are going to be difficult, and we all need to show each other some respect, some courtesy, and some kindness. Finally, if you get symptoms of COVID-19, please stay at home, get tested, and carry on self-isolating if you test positive. That's probably the most important thing you can keep doing. If we all keep on being considerate of each other, we can still reduce the impact of this virus, even as society tries to get back to something more like normal. Thank you.